Part 2. Now I will share the screen and then we'll continue. So, part 2. Washing, disinfection processes, definition disinfected, definition sterile, medical device surface sterilization processes, and inactivation factor. Definition disinfected, washing and disinfection processes. Preparation for surgical instrument surfaces before disinfection processes includes following steps. Soakings in enzyme solution containing, pre-treatment using steam or water jets or ultrasound, it's really necessary. Enzymes breaks proteins, and then it's really easy to remove them with steam jets or water jets. And after this, it's a pre-treatment. After this, washing in washing disinfecting machines. And here we have 4 steps. First one is rinsing at 30-40 degrees by Celsius. After this, washing at 55-63 degrees by Celsius. Thermal disinfection at 90-95. And after this, drying 115 or 120 degrees by Celsius. But for high-risk medical devices subgroup C, washing only 55, not more, and disinfection also only 55, not more. But here in those cases, disinfection is chemical, by chemical active agents. Disinfection process when we are inactivating pathogenic microflora and up to the amount of 100,000 times is called disinfection. A result of disinfection can be or is affected by amount of microorganisms on the surface. Here you have to understand. For example, if I have 100 bacteria on the surface, okay, disinfection maybe will be really nice. But if I have, for example, 10 million bacteria on the surface, yes, reduction will be okay, but in any case, some amount of bacteria will be still on the surface. Also, can be affected by disinfection method and means. It means not everything we can disinfect by everything what we want. For example, if we have thermal disinfection or maybe chemical disinfection with alcohol or aldehyde groups, it's always different. Also important is a contact between disinfection agent and microorganism. If surface is dirty, it's really difficult for disinfection agent to reach the microorganism and to destroy him. And of course, it's really important also compatibility of the disinfectant and material of the medical device. Disinfection can be done as chemical, thermal, or thermally chemical process. Thermal process always is more safe than chemical process. Always more safe. And why? It's because of physics. For example, if I am immersing some instrument, for example forceps, in a water and start to heat it up, what is happening? In a moment when I'm immersing those forceps, because of liquid surface tension, air bubbles are fixed on the surface. Small, invisible, but they are. Air is the insulant. Where is air? No heat. When I start to heat up water, water starts to move, and all those air bubbles are gone. Every square millimeter is in a contact with the water. Water transmits heat really fast. And when the whole mass of this instrument reaches the same temperature as the water, and this temperature reaches 60 degrees, disinfection starts from inside to outside. Medical device or this instrument disinfects his own surface with its own heat, with the presence of water. It's really safe because every square millimeter is in the same temperature, and it's really safe. When we are proceeding disinfection chemically, we have three possibilities. One is immersing, the same, spraying on, or swabbing by a disinfected swab. All those three possibilities have one common advantage. It's low temperature. Even in 20 degrees, we may try to disinfect and maybe we will reach some result. But all those three possibilities have their own disadvantages. For example, immersing. The same as with the water, because of liquid surface tension, air bubbles are fixed on the surface. But here is no movement. And where is air? No contact with the active agent, no disinfection. If we are spraying on, okay, yeah. If we are looking on the surface with the naked eye, yes, we see everything is covered, everything is nice. But to be sure about, we have to look in a microscope. And then we will see absolutely different picture. Swabbing. For the flat surfaces, yeah, more or less, it's okay. But try to swab, for example, forceps or needle holder. It's just a placebo. We think we reached all surfaces, but actually no. Yeah, it's about why thermal disinfection is more safe than chemical disinfection. And disinfection as a process is divided in three different levels: low level, medium level, and high level disinfection. If we are disinfecting in low level, we must reach reduction of survived microorganisms for 1,000 times, or 3 logs. In the result of medium level, we must reach 4 logs, it's 10,000 times. And in the result of high level, we must reach 5 logs, or 100,000 times. And in this case, speaking about disinfection, we must reach, and we must prove it that we reached. And one more thing, what is really important, that low level and medium level disinfection is not allowed for medical devices or surgical instruments which are intended for use in invasive manipulations. Yeah, and one more thing. Alcohol is a low-level disinfection agent. That you have to remember. Definition: sterile and sterilization processes. The concept sterile denotes the probability of the sterility of a sterilized medical device. Only a probability. As you can see it in a European norm, it's just a probability. it's impossible to say that yes, all of them are destroyed. Even if Dan Brown said it's possible, everything is possible, impossible just needs more time, but in this case it's impossible. Always here's some possibility that some microorganism is still alive. And this probability is called sterility assurance level. Sterility assurance level is defined as a possible presence of surviving microorganisms on the surfaces of a medical device after sterilization process. And sterility assurance level is expressed as logs. For example, if probability of surviving microorganisms is 1 against or 1 to 1 million, then sterility assurance level is minus 6 logs, or 1 from 1 million. Sterilization methods. Physical, it's saturated water, steam, autoclaving, hot air, or radiation. Saturated water, steam, it's most common method. I would say approximately 93% of all medical devices, especially surgical instruments, are autoclaved. Hot air, okay, it's also possible in a hospital's method, but it's not safe because air is not heating up instruments really fast, and we cannot control what is happening with the whole mass of instrument. Radiation is used only in manufacturers' facilities. Chemical methods, AO gas, formaldehyde, or hydrogen peroxide with or without gas plasma. Ethylene oxide is also one of the common methods. Here we have its low temperature, up to 55 degrees, but the cycle is really long, starting from 7 up to 24 hours. Low temperature steam with formaldehyde, its cycle is shorter, but formaldehyde is really dangerous for us and for the nature. Hydrogen peroxide, also low temperature method. Here we can say that it's approximately 60 up to 70 minutes. It's more or less really nice, but we have to remember that hydrogen peroxide is aggressive, and not everything can be sterilized by this method. Inactivation factor. Inactivation factor is a conservative measurement and is applicable only to the full process. And why it's conservative? Because all reductions are only at times, amount of times. It's not all of them, it's not a fixed value, but it's just at times. For example, if I have to disinfect my hands, it's a low level or hygienic disinfection, and I start to disinfect. I cover all my hand skin, then I scrub a little bit, then I wait for 15 seconds, and after this I may say, okay, if I know here was 1000 microorganisms, after this one will be still alive. If there will be 10,000, then 10, 100,000, then 100, and so and so and so. It's only at times. If you look on this, if you have just a cleaning process, during a cleaning process, average reduction is approximately 2 logs, or 100 times. Okay, Robert Koch Institute says from 10 to 1000 times It depends on technology, but in average it's 100 times. High-level disinfection, it's 5 logs, 100,000 times, and sterilization process 6 logs, 1,000,000 times. But if we are doing this separately, it's only 100 or maybe 100,000 or maybe 1,000,000. If we are doing this one after another, then 100, 100,000 and 1,000,000, it's 13 logs or 10,000 billion times. And this reduction level is called inactivation factor. And actually, every time when we are reprocessing medical devices, we must reach this reduction level. Always. But remember, reduction is only at times. It's not a fixed value, it's not all of them. So, one more time. Any reduction of surviving microorganisms during reprocessing is only a certain number of times. Only a certain number of times. Please remember about this. Okay, now we'll go to part 3.